Hello. So it's ACA open enrollment, and I'm sure you have a lot of questions. So, what I wanted to do is to take a minute, go through the process with you, explain some of the details that you might not understand, because heck, why should you if you don't sell insurance? And hopefully make this a little less intimidating than it might seem. So, when the ACA, the Affordable Care Act, was passed, most of us know it as Obamacare. What it did was a few very important things. One, it guaranteed that everybody could be insured regardless of pre existing conditions. And two, it attempted to make sure that everybody was insured at least to a certain capacity. So, in order to do that, they've built things into the system such as subsidies, which is a good thing because these insurances without subsidies, health insurance in general, can get very pricey. And that's why it's so intimidating. But with these subsidies, many people end up paying nothing every month for the insurance they need or a small amount. Uh, so, what do you do when we start this process? The first thing we do is we talk about you and your needs. Are you insured now? What doctors do you see? What medications do you take? That kind of thing. What doctors do you expect that you may see? And it's important that we take time to talk about that because each plan is not going to be right for each person. We need to find a plan that one, fits into your budget, and two, will cover your needs. So we have to make sure those doctors are in your networks. We have to make sure that your prescriptions are covered. We have to make sure that co-payments, if any, are very low. And we have to make sure that this is designed for you. So that's the first thing. Also, I don't want you to think that we'll be talking about a lot of personal information, at least not at first. And another thing is, I'm never, and anyone doing this should never be asking you for your bank account information uh, or anything like that, because the payments are all between you and your medical insurance. And that's if there are any payments. The kind of information we will be talking about is your birth date, the birth date of all of the members in your household that you're trying to get insured. And I'm also going to ask you, what do you project your income to be next year? Your household income. The reason that I ask that is your insurance subsidy is based on a few things: family composition and your projected income for next year. And notice I say projected income. So I'm not asking you what you made this year. I'm saying, what do you think you will make next year? We're all in flux every day of our lives. Some of us will go up, some of us will go down. So I'm asking for your honest best projection. If you're a business owner or an independent contractor, I'm not asking you how much money came in. I'm asking you how much did you keep? So there's all kinds of deductions that you have to consider. And if you're an entrepreneur, you know that. But again, the number that's important is, what is your projected household income next year? So when we're armed with that information, the process starts. I know who you are, who you're getting insured, birth dates, projected household income next year. We've talked about your doctors, we've talked about your meds. Now it's time to look on the marketplace and figure out who serves you. And then what we'll do is we'll find several options and then we'll discuss those. Option A may be better for this, but option B might be better overall. And then we'll make a decision together as to which one is best for you. So now we've found your policy. And by the way, you can start this even if you've been uninsured for years. You can do this even if you haven't filed taxes. Um, we can work around all of those things, but now we've found your policy. Now, what I or any reputable health insurance person will do is enroll you through the federally facilitated marketplace. You can get tongue tied if you say that too quickly. Federally facilitated marketplace. And that process is very easy. At this point, I'll ask for a piece of personally identifying information. I'll ask for social security numbers of the people involved. If for some reason you don't have that, okay, we'll still go through with the process without it, but it may require future verification. And if that's the case, you'll get a letter and they'll say, hey, we need this, and then you'll provide it, and so on. Now, like I said, in a lot of cases, there is no bill to you for this coverage, but if there is, that's something between you and the insurance carrier that you provided. You'll have the option, as most people do, to put it on direct payments if you want to. If not, you don't have to. Again, that's between you and the insurance provider. I have no need to get into or desire to get into your checking account. Um, and then the process is done. So, what would happen is anybody that enrolls during the open enrollment period now until December 15th, your policy would be effective on January 1st. We'll know while we're on the phone if I've got you covered. Now, throughout the year, there are special enrollment periods. So, and special circumstances. If your income is at a certain level, we can enroll you all year long. If you move, you have any major life event changes, we can enroll you all year long. So don't hesitate to reach out if you're stumbling on this afterwards. But in that case, if say I would enroll you today, November 4th, your new insurance would be effective December 1st. That's let's say today was November 27th. Your new insurance would be effective December 1st. So I know it can seem confusing, but work with a competent advisor. We'll help you get it in place. My phone number is on this. Please feel free to reach out. I'd be glad to answer questions. Hope you have a great day, but don't forget the clock is ticking. Open enrollment period ends January 15th. You need to take advantage now because during open enrollment period, pre-existing conditions are irrelevant. Well, in general, on the open enrollment and in the ACA marketplace, this is not based on your pre-existing condition. So don't think just because there are those things that you're not going to be able to get affordable, comprehensive coverage. Have a great day.